product from Pwani Oil.
Welcome back to Weekend Prime. Let's now take a look at what you will be reading in Kenya's bold newspaper tomorrow, the Sunday Standard. Auction house. Dishonorable. Embarrassing admissions by members of parliament that money influences decisions have ripped the lid off what critics describe as one of the country's biggest parliamentary scandals. From receiving 10 million shillings inducements during the Gachagua impeachment to claims of sacks of cash exchanging hands, the accusations paint a chilling picture of a legislature where laws and oversight votes are often auctioned to the highest bidder. With just 1 year before the expiry of their term, will the 13th Parliament go down in history as the most corrupt? That story is on page 6. You can also get to read about state agency CEOs on a chopping board. That story is on page 8. Make sure you grab yourself a copy of the Sunday Standard and get to read about the auction house. Let's now talk about Matters Health, and it's about your favorite health segment of the weekend. And the burden of hepatitis B, an incurable liver infection, remains significantly high in counties like Baringo. And while these counties continue to struggle under the weight of the public health threat, efforts to combat the disease are constantly threatened by stigma and misinformation. And as stigma impacts on this fight, hepatitis B virus mutations is yet another factor scientists warn is slowly impacting on the detection of the virus. On this episode of Health Digest, Gloria Milimu interrogates why combating stigma is crucial in eliminating hepatitis B and how advancements in diagnostics could bolster Kenya's response efforts.
A persistent crisis continues to linger in the vast Baringo County, a crisis that is slowly but consistently impacting negatively on the county's response towards one of the world's greatest public health threats, hepatitis B, a viral disease whose diagnosis attracts both public and self-stigma. Almost every homestead in Marigat sub-county has been impacted directly or indirectly with the liver disease. We set out to meet with one of the residents who is currently living with hepatitis B. At Kivumbini area is where we meet 59-year-old Florence Kiprono, who was diagnosed with the disease in 2014. She's the only person in her household who tested positive for hepatitis B and has had her fair share of stigma, often associated with the medications used to manage the condition.
Kenya ilikuwa inanikosesha amani ni ile niliona dawa yenye ninapewa ni dawa yenye ninaangalia ni kama ni ile ni ya HIV. Sasa ilikuwa inanitatiza kuelewa ni HIV ama ni hepatitis B.
For the longest time, misinformation dominated conversations around deaths that were linked to what people in Majimoto area in Mogotio sub-county referred to as a strange disease. This made it hard for people like Joseph Kemboi, a resident of Majimoto area, who was diagnosed with a viral infection that affects the liver in 2017, to seek treatment in good time.
Ilikuwa watu hawajajua kwanza ni nini. Unajua mtu anakonjeka anapelekwa hospitali, anapimwa magonjwa mengine lakini hawapati ni nini. Alafu mwisho mtu anasemekana amefariki na ile liver yake imeisha. So wakati sasa tunapata results ya mwisho baada ya mtu kufariki, ndio inapatikana ni nini? Hepatitis B. Lakini ilikuwa haijabainika ni nini. Sasa watu walikuwa wanachukulia dhamira ya kwamba labda ni uroki.
Although the fatalities prompted mass screening in the area, subsequently paving the way for sensitization of the disease in his village, he reveals that stigma has taken root among the residents.
So jambo kama hilo la stigma iko kabisa. Mtu kwanza usipoamua kwa moyo wako useme liwe liwalo, kama watu watanichekelea ama watu watanistigmatize aje, bado mimi nitaendelea kumeza dawa. Kwa sababu gani nasema hivi? Kuna watu nilipimwa, hata mimi tulipatikana tulikuwa watu wengi sana, lakini wenye walifuata ile maagizo ya kumeza dawa utakuta ni wachache. Wengine wakawachana naye. Kwa sababu gani? Ile stigmatization.
So rife is the vice in the county that this 25-year-old man requested us to conduct his interview kilometers away from his home. He tells KTN that he has faced stigma ever since he was diagnosed with the disease in 2019.
Kufika shule tena ni changamoto nyingine mpya. Na nilikuwa najiuliza tu itakuaje, nitakula aje kama hao wanafunzi wakiniona. Ilikuwa stress. Nikaona kuliko ni wache dawa. Kasema wacha tu ile uliwalo. Nikaamua kupack madawa kwa wallet. Nikaweka kwenye wallet yangu, ili nikitoka nje naenda kumeza alafu narudi.
Scientists warn that stigma can fuel mutations of the virus. These mutations, according to virologist Ochwoto, can impact on detection of the virus.
Since it has certain regions, it is prone to mutations. Another mutation that we have noticed is on the surface antigen region. This is the surface antigen that is used for detection. Because of mutation, we have noticed that some people who are infected, if you use a rapid test kit, or if you use certain kits that are not a combination of a comprehensive kit, usually it misses detecting those individuals. This in science is called occult hepatitis B.
So around 10% of people, the disease is able to persist. And then out of this 10%, there are those who are able to go to complications such as liver cirrhosis, which is a scarification of the liver due to the inflammation caused by the virus, and some percentage goes to cancer. So we get hepatocellular carcinoma.
Kenya is, however, hoping to improve its diagnostic testing to help address some of these challenges using one of the most advanced technologies.
It has a specific position. So as you see now here, the interaction of the devices is very simple. All what I did is just putting the sample in the plates, putting the plate in the device, then I choose which protocol that I will use, then I go for the start, and less than 20 minutes, I'm going to have my results.
The process entails training of the country's scientists at the Kenya Medical Research Institute to enable them to detect viruses like hepatitis B early enough in order to help prevent new infections.
The numbers of the scientists have been trained, like almost till now is about 30, and they have been trained in terms of using the hands-on technicality of automated devices and semi-automated device for the real-time PCR.
Scientists say in order to combat hepatitis B effectively, there's need to invest in sensitization efforts and diagnostics, as testing remains an essential entry point in accessing hepatitis B prevention.
Non-funding has affected what we know about hepatitis. If possible, both the national government and the county government can find a way of supporting the research and the activities of hepatitis.
Currently, an estimated 1.9 million Kenyans are living with a lifelong condition, with counties such as Turkana that has the highest prevalence rate of 16%, followed by West Pokot and Baringo with prevalence rates of 11 and 10.8% respectively, bearing the brunt of hepatitis B in Kenya. Gloria Milimu, KTN.